Okay, so a lot of people have questions, what are facial fillers? So facial fillers can be a variety of products. So there's hyaluronic acid, which would be Juvederm, Restylane, Versa. There's a lot of products. Hyaluronic acid is a product that's naturally found in our body. Depending on the molecular size of it, the viscosity will depend on which product we use and what area we place it in. It is dissolvable, so if you're not happy with it, we can use an enzyme called hyaluronidase to dissolve that product. That is one type of filler. Generally, it will last you anywhere between 6 to 12 months. The other option is Radiesse, which is calcium hydroxyapatite. It's a product that's calcium-based. It can last people up to 18 months. It is also an injectable product. It cannot be reversed. Most people with Radiesse, it's good for people that are very hollow or they need a filler that's going to last longer. And it is not dissolvable. There is a product that we can use to break it up, but it is not dissolvable. The other option that we have is Sculptra. Sculptra is collagen stimulating. It is going to last you up to about 2 years. It is a product that you don't see the result right away, but over the next 12 weeks, that's when you'll start to see that product. You will need several vials of it. That is a product that is, we call it PLLA. So it's a product that we mix with a bacteriostatic saline and we will inject it usually with a cannula. So that is another option. So whether you use Sculptra, whether you use Radiesse, or you use an HA will depend on what your goals are and what areas you're wanting to be treated. A lot of times if people are wanting to do temples because it's hollow up in the temple area, we can inject filler up in the temples to give you that more youthful look. So depending on what your goals are would depend on what product we're going to use. So when you're doing fillers, cost varies depending on the product that you use, the amount of product that you use, how long you're wanting your product to last. So there's a couple of variables. Generally, we say lip filler will start usually around $600 and go up from there. Tear trough filler will start at around $900 and go up from there. Cheek filler, the same, around $900 and go up from there. It depends on how much product you need and what your goals are of longevity wise. So that's where it's important to come in for a consultation with someone who is qualified on doing these injections so that you get the proper product placement and the best cost for what you're wanting to accomplish. Because if someone doesn't know how to inject it, they may end up using more filler than they need because they don't know how to inject it properly into the right plane. The other thing that people have is how long is it going to take to do my treatment if I'm wanting to do fillers? Well, it depends. It depends on how much product you're using, what areas you're doing. If you're doing Sculptra, if you're doing Radiesse, if you're doing an HA. If you're coming in for lip filler, then your product, it might take you 10-15 minutes to do the treatment. Sometimes if you're doing cheeks, it can take me 15 minutes. Sometimes it would take me longer. It just depends on the area that we're treating. I would generally say you're looking at anywhere between 15 minutes to an hour and 15 minutes to do treatment here at Zona Med Spa. And that's because we're very experienced at doing these injections. I've done thousands and thousands of treatments and I have a lot of experience. So with that being said, when someone has a lot of experience, they know where to place the product to get the best result and which product to use. The most common areas that we're going to use fillers nowadays are going to be cheeks, lips, nasolabial folds, and tear troughs is the most common. However, it's not exclusive to those areas because there's times when we're going to do temples, there's times that we may do the forehead, there's times that we may do the chest, the neck, and also we may even do the hands because these areas as women age, their hands lose that collagen. So we may even do some filler in the hands, or if they have lax skin in the knees or in their arms, we may do filler in those areas as well. Or if you're wanting to do what we call a BBL with fillers, we can also use filler to give you a little bit more of a rounder tush. So when you're doing fillers, people always ask, how long is the filler gonna last? What's my recovery? What's my downtime? When will I see the result? So let's start and break this up a little bit because some products are different than others. If you're using a HA, which is like Juvederm, Restylane, Bellatero, Versa, those products are going to, you'll see your result right away. Give or take about 25% of that is going to be swelling. The swelling can last for, 3, 4, 5 days possibly, depending on the person. So results are instant, give or take 25% of swelling and bruising. Downside to bruising can last up to 2 weeks, but there's really no downtime. The results are instant. However, if you're using Sculptra, with Sculptra, you're gonna have some swelling immediately. You're not going to see the result for about 12 weeks, and you're gonna be doing continuous treatments to get the final result, which you'll do your treatments about a month apart. There's no downside to doing fillers other than swelling for a few days. You might have bruising that you could possibly cover with makeup. If you're taking anticoagulants, aspirin, ibuprofen, fish oil, take Adderall, drink a lot of green tea, caffeine, things like that, expect your bruising to last a little bit longer. If you're older and you have thinner skin, that bruising can also last a little bit longer. And everyone bruises different. Some people don't have any bruising, while others can have significant bruising. So it just depends on your pre-care, your post-care, and just your genetics in general. So on results, if you're using an HA like Juvederm, Versa, Restylane, Bellatero, an HA, your results are gonna last you generally about 6 months. Sometimes it can last longer, sometimes a little bit less, but a general rule, we're gonna say 6 months. If you're doing Radiesse, that can last you anywhere between 12 months. I've had it last up to 24 months with full correction. So I say 12 to 24 months. If you are using Sculptra, I'm gonna say it's about the same, 12 to 24 months, depending on the amount of product that you're using and whether you're using full correction or not. If you're maintaining your lip fillers, it can last you even longer. It can last you a year. It just depends on the area and the product. If you're doing tear troughs, your tear trough filler is going to last you longer. We generally can see tear trough filler last sometimes 1 to 2 years. So for an average patient, usually when we're doing lips, we'll generally start with 1 syringe. For the lips, I never do more than 2 syringes in a setting because the swelling is too significant. So we like people to do 1 and then come back and we can evaluate and determine whether they need another one. 1 syringe is not a lot of product. So a lot of people think, oh my God, that's a lot of product. It's really not that much product. If you have a teaspoon, it's about the size of a teaspoon. It's a very small amount. And you're spreading it in a little bit, a pretty large area there. If you're doing product, the amount of product that you need varies per person, it varies per area, and it depends on what outcome you're wanting and how much volume loss you have in that area would determine how much product and what product we would use. So side effects that can happen with any type of fillers vary from person to person and if they happen. So if you have an adverse event, there's always a risk of bruising, swelling, infection. There's always a risk of getting little nodules from some of the fillers. There's always a risk of vascular occlusion. So if these things happen, you want to make sure you go to a good provider that knows how to treat and prevent these complications. It's rare that it happens to have an adverse event that is significant like a vascular occlusion or nodules. But bruising and swelling, I tell everybody expect bruising and swelling because we're injecting a needle into your skin. So there's always the possibility, depending on your skin integrity and your vascularity and how thin your blood is.